U.S. COVID-19 death toll has reached another grim milestone, surpassing 900,000 deaths since the beginning of the pandemic, and in just under 7 weeks, 100,000 deaths. While death tolls continue to rise, the number of daily cases over the past 7 days have significantly decreased.
The current 7-day daily average of cases is about 446,400 cases per day, a decrease of about 36% over the previous week. The 7-day average of hospital admissions is about 17,100 per day, also a decrease of about 14% over the previous week. And the 7-day average daily deaths are about 2,300 per day, which is an increase of about 4% over the prior week. While we continue to see large decreases in average daily case counts across the country, hospitalizations remain high, stretching our healthcare capacity and workforce to its limits in some areas of the country. And daily deaths also remain quite high.
As the number of vaccinated Americans continues to increase, parents of children 6 months to 4 years are concerned about their children's inability to be vaccinated.
We would have vaccines available for essentially all age groups in America. This would be a major milestone. Now, there are a number of steps ahead to determine if the vaccine is both safe and effective for our kids under 5. And please know that the FDA will not cut any corners in their review process. They know that they are the gold standard that all of us rely on. If and when the FDA and CDC decide to move forward, we will work closely with our trusted community partners to ensure that families have accurate science-based information about the vaccine so that they can make the best decisions for their children.
Americans are hopeful that as the winter begins to end and vaccine rates continue to increase, that the pandemic will become less of a factor within everyday life. From Washington, Maria Bird, Channel Television News.
And Maria joins us right now. Hi, Maria. Over the weekend, the grim milestone, 900,000 deaths was reached. Are there other factors that are putting people at a high risk of COVID-19? Because compared to other countries, perhaps in Europe, there seems to be something different happening in the United States.
Well, you're exactly correct. There is something a little different. But I will say that, as we all know, that when you have higher case counts and then obviously higher hospitalization rates, it takes a week to 2 weeks and almost sometimes a month for those death rates to catch up with the decrease. And so that's really what we're seeing right now. We had obviously the Delta variant was very, very strong within the U.S., especially for those individuals who were not vaccinated. It ended up having a heavy toll on the hospitalization rates. And obviously then, unfortunately, many people did die as a result of that. We are beginning to see a phasing out of that Delta variant. And the Omicron variant obviously is the variant that we're now seeing that's causing the most number of cases in the U.S. But that death toll rate we should begin to see in the coming weeks should be decreasing as we continue to see the number of cases decrease as well.
But a number of people wonder how you tie them together. Death tolls are rising. On the other hand, a decrease in confirmed cases. And then what role is Omicron playing if it's majority of the variants in terms of the infection and we're having less, the Delta variant being totally phased out?
Yes, the Omicron variant has had a major impact on the number of cases, but what we've also seen is a heavy increase in the actual vaccine rates. We can also tie this to the 5 to 12-year-olds being vaccinated. We know that that group of individuals are in the elementary school age. Those age groups are highly, they physical, they're in close contact. And so the spread was obviously much easier in those environments, which then would make it susceptible to the parents and elderly individuals that they might go home to. And so the spread case with the Omicron variant was just at a much higher rate than what we had seen before. And so that heavily played into the role of the case counts. But as we see vaccinations coming into play, we are seeing a decrease in cases, which then means it's been also a decrease in testing. We know a couple months ago you would see lines around buildings for testing. But now with the increase of testing availability within the schools, within even having the federal government send tests to individuals' homes for free, and the ability to have free testing home kits, that is also assisted with seeing the decrease. And so there's a number of variables that are helping to ensure that individuals are having a reduction in the number of cases, which then we will begin to see, obviously, a reduction in hospitalizations, hopefully soon, and then a reduction in the death tolls as well.
What have you heard, especially parents' concerns on vaccination? Are they comfortable about kids under 5 for COVID-19 when there is the final approval?
There's a major concern for those parents of kids under 5. I think that we're beginning to see that 5 to 12-year-olds are beginning to safely interact with one another, having what many consider play dates with friends, going to the playground, feeling comfortable with that. But for those individuals who are in their early developmental stage and they're really trying to figure out socialization and appropriate play, to not be in an environment that allow them to do that due to the fact that they are not vaccinated or don't have the ability to be vaccinated, has major concern for many parents. Even the U.S. Surgeon General announced and said that, that's a major concern for him, as he has a 4-year-old child that's not able to be vaccinated. So Pfizer and obviously the FDA are really working hard to try to see if there's any way possible, with obviously still making sure they do all the appropriate requirement checks for those under the age of 5 to be vaccinated. But we are expecting that definitely by the spring, when we know the weather will be better as well, those individuals should also be able to get vaccinated.
Our Washington correspondent, Maria Bird, many thanks.